The event, which is aimed at bringing quality healthcare to the doorsteps of the people in and around the Dome Kwabenya community, where the church's headquarters is located, forms part of the church's corporate social responsibility. The Director of Missions for the Maker's House Chapel International, Dr. Emmanuel Sarkodie, explained that the health screening was to enable the people of Dome Kwabenya know their health status.
The whole idea is that not everybody can even afford the minimum requirement that you need to enter into any clinic. So you get your medications, you get your doctors, your clinicians, your nurses, we go into the community. The most important idea is not to go there and go and even heal their disease. The most important thing, if you ask me, is to fish out conditions that people are living with that they do not know. As the old adage goes, prevention is always better than cure. And as a medical doctor, I would tell you that when your condition is far advanced, by the time you get to the hospital, there's nothing much anybody can do. Or even if you can do something, you will need more money to do something. So when we do screening, you pick up certain things early. And once you pick them early, it's easy to treat.
Priscilla Araba is head of humanities at the Maker's House Chapel International. She explains that her department is like the human resource department in every company. According to her, apart from their physical well-being, they are concerned about their spiritual well-being as well.
I mean, if you look around, we even have the evangelism team next year. And they are here to also spread the news, to introduce the church to the people who are here for the screening, as well as even promote the local assembly, which was recently, launched in the church. So we work together with all the units in the church. And anytime humanity is out there, it's also about winning souls for the church. So as we speak, we have the evangelism team who are also doing their bit to ensure that in as much as we are giving helping hand to the people, we are also preaching Christ to them.
The medical team, made up of general physicians, nurses, ophthalmologists and other medical personnel, screened the people of malaria, hypertension, diabetes, infections and many other communicable diseases. After getting screened, the people were given free medications as well. Here is the co-founder of the Gold Coast Medical Foundation, Dr. Kwabenya.
So we're doing a lot of screening. We're screening for the basic chronic medical conditions as well as infectious diseases as well. So the basic chronic medical conditions, blood pressure, diabetes, cholesterol, those are the highest, the highest chronic diseases that are killing most of our people. It can lead to heart attack, stroke, kidney disease, eye problems. So we're screening for those, and if anyone is identified to have either high blood pressure, which is hypertension, or diabetes, we start treatment based on what their readings are. We start treatment, and we also educate them on, because you can keep your blood pressure under control in addition to the medication with some lifestyle changes, what you're eating, what you're drinking, your activity level. So we educate them on those things as well. And we express the need for them to continue to follow up with clinics and doctors. So if anyone has any condition that we do not have medication for, or they do not need medication but need further evaluation, then we do take a list and we refer them to centers that can assist them, and then we follow up with them. Now, we usually assist them with the cost of what is involved to further diagnose whatever is going on with them.
Angelina Kodua-Nyano is a public health consultant. She explains further the need for people to take advantage of the free medical screening.
One of the things that we are talking about is lifestyle, a lot of lifestyle, because these conditions are lifestyle-prone diseases. So we talk about hypertension, diabetes, obesity, and so we try and do our BMI to see your height, your weight, whether you are obese.
If you say BMI, what do you mean by BMI?
Okay, body mass index. So your body mass index, your height should be appropriate to your weight. Okay. So sometimes if you are not too tall like me and you have some kind of weight, then you are termed as obese. And when you're obese, it prone you to a lot of health conditions. Okay. So in our education, we are talking about exercises. We are talking about eating well. Eating well means a well-balanced diet. So drink water, eat fruits and vegetables. One thing that we also have talked about is the prevention of malaria. As we are in the rainy season, And in marketplaces, we know that people don't have very good environment to sleep, to do all that. So we talk about prevention of malaria, sleeping in mosquito nets, cleaning your environment to prevent stagnation of water and all that. One thing that we also want to talk about is HIV. We realize that you cannot look into anybody's face and say the person has HIV. So as much as possible, we encourage people to know their status. HIV testing is free, medication is free, testing is free. So even if you are not able to do it here, because a lot of people are gathered, walk into any health facility and say that you want to know your HIV status. It's free of charge. When you test and you are positive, the medicines are also free. So these are some of the things that we are talking to the people. If you look around, you see that most of the people seated here are aged. So we are doing eye screening, we are checking your BP. We are checking your BP. And those that we realize that need further management, we refer you to facilities.
The General Overseer of the Maker's House Chapel, Dr. Michael Bwedi-Nyamiche, stressed on the need for people to be in good health. According to him, you can only fulfill destiny if you are in the best of shape.
The turnout, amazing. The doctors that came from the US and their local partners, the people who, the medical officers from Kolebu and the other places, they've all been amazing. And you can tell that the people have benefited immensely. I mean, we have recorded hundreds of people coming to be screened, whether it's diabetes, hypertension, hepatitis, all the medical conditions that you can think about. And there is a pharmaceutical unit. So if there is a diagnosis there, they give medication so that you'll be able to take care of that. They look at your eyes, they do all of that. So I think all in all, it's been a massive one, it's a great one, it's been beautiful. But I'll just encourage everybody to take care of their health, because without good health, there is nothing that you can really do or achieve. If you have all the money in the world and your health is wobbly, there is no way you can even enjoy the wealth that you have. And so we want to use this opportunity to encourage all viewers of New TV, people that are watching New TV now, and all the people that are on New TV, to take their health seriously. And remember that if you want to fulfill destiny, you need to be in the best of shapes, as the best of health, to be able to do that. Next year is not something we are doing as one-off. Next year will come again. We're going to do it again, and we want you to lock down the dates and get ready, because we're going to play it on New TV as well, but it's going to be a blessing to everybody.
Some beneficiaries who couldn't hold back their joy after going through the various screening and getting their medications shared their joy with New TV.
What about your friend saying?
Your friend Georgina Tando.
And Oba no one is saying, I show you.
Bibia, send your homage James so. Baby, I'm back to be our mama direction, Bibia. And at times you hear say, one more by free screening. When you go there, you won't get it totally free. But here, I had everything free, and I'm seeing everything free here. So I'm proud of you.
That's an awesome news.
Verse. Oh yeah, dear me who no abomi pusa. Ama me who say, ya was sumbi, and ya was sumbi. Na dia sofu Bwedi Nyamiche ene wamu panyini Dr. Boachi omu aye no ayame fe pa nyame nhira omu bibia omu aye bia nyame nhira mo nyame enkoso nhira mo empeja omu ma na yehu yaye Oliver we humbly ask for more ni yenim say more will come na me dead through this so nyame be peja sorry ene team a wo mo bae no wo mo adwuma ye wo mo aye kese
Angelis Bafo.
Okay. And Obaye no who screening is saying.
Oh, anya bad my idea. Ebebre ba but most mo dey anya bad. My idea. And am your service so the way am receive will be so be question obey na the way am your line ni ade no. Anya bad. My idea pa.
And we check it for day. Say ebia so betimi aka.
Bia baby am be check am bia me check it. If you say medical go check bi dada me tue scan ne boarding. Enti we no mo ya che free de na tese nyame nhira mo aseda ne eda mo ase bebre so mo adwen ye ho na mo ya ma man ni free
ye ba ya anje ye hwe de obekire bia nso mo ye ma ho
ho aduro nyina
anyanya ho aduro nyina
ti uko we nyina table so
akoni nyina na mkɔhwe mani nso ka ho o mama me space enu nie
yey o ho aye fa papa
The doctors are very friendly. When I came, the doctor asked me the percentage, as in how I was feeling. I came with 10%, but by the time I left, I came out with a smile, and I rated him 85%. So I think half of my problem is almost solved. So I'm very, very happy. Those living around Dome Kwabenya and the surroundings, I will entreat you all to also come for the screening. It's free. We are not only checking what's on the banners, any other illness you have, we tell them and they'll give you medications. So I really had fun.